ваше впечатление о Москве?
What is your impression about Moscow?
Well, I have been to Moscow previously. I didn't get a chance to see too much about Moscow, much around Moscow, but it was been an excellent conference, and I thought the educational interaction has been fantastic.
И пожелания участникам Конгресса?
Do you have any wishes to the participants of the Congress? Would you like to wish something?
Oh, I just, the goal of this is to make sure that everybody exchanges ideas and techniques that help with patient safety and better outcomes. So my anticipation is that people will utilize the techniques and the discussions that we've had in order to improve patient care.
И еще несколько вопросов.
And there are some more questions.
Как вы видите индустрию пластической хирургии через 10 и через 50 лет?
How do you see the industry of plastic surgery in 10 years and in 50 years?
Well, in 50 years, it won't matter to me much. In 10 years, I'll probably still be practicing. I think it's going to continue to evolve. Plastic surgeons are very innovative. Plastic surgeons have been on the front line on many of the innovative techniques that have come through. So I think we need to continue to be innovative and develop new techniques. Plastic surgeons are kind of really one of the last true general surgeons, because we do operate still on every part of the body. So as things become more specialized, we still have to understand a variety of areas of the body and different techniques to operate on them.
А какие, одна-две прорывные технологии появятся в ближайшие 5 лет?
So do you expect any new groundbreaking techniques to appear in 5 years?
Oh, absolutely. As to what those are, I don't know, because a variety of the liposuction techniques and non-invasive liposuction techniques, cool sculpturing, thermi, some of the other technologies that have come out have all been within the last 5 years, actually shorter than that. And there's a variety of maybe new neurotoxins coming out besides just Botox and Dysport and some other components. Maybe new breast implants will be developed. So it's changing constantly, and I just don't know exactly where that change is going to be.
Окей. Немного для молодого поколения. Расскажите, что может сделать молодой пластический хирург для создания личного бренда?
He wants you to make some suggestions to young surgeons. What can a young surgeon do to create his own brand, so to say, to create himself as a brand?
Yeah, I think what's more important than creating your own personal brand is to do good work, to become board certified in plastic surgery, to, we call it the kind of the 4 or 5 A's in the United States: be available, affordable, affable, and ultimately be engaged, So everybody will be successful. Everybody will come out and take care of good patients, take care of patients well. I think the hard part with younger people is they're always looking for a new branding component to make them different than everybody else. I don't think that's necessarily what you have to do. What you need to do is to understand the techniques and the principles and provide excellent patient care, and you will become very successful.
И последний вопрос.
And last question.
Что касается образовательных инициатив, какие выводы ввели образовательные инициативы в России?
As far as educational initiatives are concerned, what kind of educational программы вы имеете?
Ну да, образовательные инициативы, активности, которые есть в Америке, нет у нас.
So what kind of educational activities would you suggest introduce in Russia that you have in the US and we don't have here?
Well, I think you probably have everything that we have. I don't know if you do webinars. Have you done many webinars? So that's an opportunity. I mean, you have social media. We do a lot of social media to get educational material out there. Instagram, Facebook, tweeting, all those I think are great to get patient education material out. Webinars may be an opportunity. We still have conferences, but we're trying to do more things online because it's not everybody can leave to go to a conference every month, and it's a lot more expensive. So we're trying to look at ways to get the educational material out there besides just sitting in a conference room and having lectures done. I think this conference today, over the last couple days, was great because you had both live surgery and you had, lectures as well. I think both those work well. Sometimes filming the surgery ahead of time so that you can actually cut down the length of time and hitting the high points sometimes works a little bit better just because you have an opportunity to have then the speaker, the person who operated, in the same room discussing techniques and so forth. But all of these are great educational opportunities, and we just need to keep moving forward in that regard.
Последний вопросик.
More or less question.
It's very interesting. Что касается коммуникации между пластическими
As far as communication between plastic surgeons is
Yeah.
какие
concerned,
тут инициативы можно вводить в России, какие
what are the initiatives we can introduce in Russia that you have in the US?
Well, yeah, I think it's a give and take, so that you provide us with just as much educational opportunities as we may provide you. So we've have a couple of international organizations that it's an opportunity for international plastic surgeons to get together and discuss through a symposium and a variety of other techniques. So it's a little harder for me to kind of say what should we bring here because I don't know what the needs are in Russia. I mean, you have all the spectrum of plastic surgery, but from a training standpoint of view, I don't know what the trainees need. We have, through the American Society of Plastic Surgeons, a lot of educational material for trainees. That may be an opportunity for people to get what we call curriculum, to get examinations to have them take for plastic surgery. So I think there's a lot of material out there. I think what would help us is to figure out what your needs are, and then we can certainly try to help provide some of those.